Welcome to the series Person of Interest. Episode 2, The Doctor and Vice Chief Defence Force. When truth depends on who writes the report. Brought to you by the Australian Investigation Agency, fighting for truth, accountability and justice. My name is John Armfield, and my 20-year career as a Navy clearance diver ended, as stated by the ADF experts on the 5th of May 2023, due to systemic defence failures and errors. Listen to the ADF medical expert state what the evidence already shows.
Officially, I'm sorry this has happened to you. There's been a number of errors and they keep occurring. I'm sorry that's happened. I'm acknowledging those errors have led to a deterioration of your health and probably led to the situation where your service in the ADF is probably not good for you at the moment. That may change in the future, it may not change in the future, I don't know, but I'm sorry it's led to that. If these 100%, if these circumstances didn't occur, we'd be in a different situation.
Errors occurred and they kept occurring. These are the words of defence medical and legal officers used to describe what happened to my brother after his first suicide attempt. But more than a decade later, no one has explained why those errors, which defence admitted, never resulted in accountability. The medical system. The senior medical officer at RAF Edinburgh admitted being 40% undermanned and that it impacted my brother's care. Defence records confirm this statement. At the time, we were 40% short on staff. Yet, when the Chief of Defence Force asked the Vice Chief to review the case in 2012, the outcome said otherwise. That manning was appropriate and any increase would not have changed the outcome. The senior medical officer, through his lawyers, argued that Andrew was not under active medical care because he was being treated in a civilian hospital. The Chief of the Defence Force later rejected that claim, confirming all serving members remain under ADF care, another clear contradiction. Also note, our family was never aware there was lawyers involved. Despite this, the official defence findings stated that while the senior medical officer and commanding officer technically breached policy by not convening a risk management team, their actions were not unreasonable in the circumstances. Two completely opposite statements, both from defence, and yet no investigation into who was right. Was the senior medical officer exaggerating to excuse medical negligence? Was the Vice Chief downplaying systemic failures to protect Defence's reputation? We still don't know. The IGADF findings. In 2023, I submitted 5 matters to the Inspector-General ADF, asking whether anyone had been held accountable for failing to form a risk management team, for failing to make a crisis management plan, for allowing my brother access to alcohol on a black label drug mirtazapine for depression, for providing misleading evidence, and for ignoring policy breaches caused by staff shortages. The Inspector-General ADF responded with these findings. Finding 1, medical staff were in regular contact with the hospital clinicians. Finding 2, there was technical non-compliance with suicide prevention policy, but the decision not to convene a risk management team was deemed not unreasonable. Finding 3, policy was later reviewed and training introduced for medical officers. Finding 4, current mental health policy is now clear about responsibilities. And finding 5, there was no evidence that increased staffing would have changed my brother's clinical management. Failures are acknowledged, yet labelled reasonable. Accountability is replaced with procedure. So how can defence acknowledge contradictions, breaches of policy, and staff shortages, yet still decide no one's at fault? I've lost my brother and my career. If a sailor or soldier or airman fails to follow an order, punishment is immediate. But when senior officers or medical authorities ignore suicide prevention directives, it becomes a matter of interpretation. Why was no one investigated for these contradictions? Why does the truth depend on which defence office writes the report? Was it about protecting medical practitioners? Or was it protecting defence's reputation? Australia, this is your ADF. You deserve those answers. I deserve those answers. On the 5th of May 2023, during a recorded defence meeting, a senior medical officer and an ADF legal representative described this entire situation as a legal minefield.
This is why you have insurance, so the lawyers can take you through the legal minefield of what's going on. This is a legal minefield, right? And this whole case is a legal minefield. Two different agencies, they're responsible. It's a total legal nightmare, which is why we have the lawyers to help us.
Yeah. Those words confirmed what the evidence already shows. These systemic failures didn't just cost my brother his life. They ended my 20-year career. I'm John Armfield. This is the person of interest. I'm seeking truth, accountability and justice. Australia, you decide if an error or a failure has occurred, please. Thank you.